Good afternoon, one and all. We are into the next session, which is National Digital Health Mission to Transform Fundamental Blocks of Healthcare. We have our panelists here. In this panel, the experts will be deliberating on the technology leveraged in rolling out the national health stack. So, how NDHM will empower the personal record of citizens. So, we have different segments of people here. We have a very rounded panel. So, I would like to introduce Dr. Biren Chauhan, Group COO, Sunshine Global Hospitals, who will be the moderator for the session. Dr. B.K. Mishra, State Program Officer, Tuberculosis and AMB, State Health Society from Government of Bihar. Dr. Ravi Gaur, Director and Chair, Medical Advisory Committee, Onequest Laboratories Limited, who also is closely working with the NDHM team. So he has a lot of things to offer. Mr. Gaur is there, and Maj Gen SC Pareek, Executive Director, Bhagwan Mahavir Cancer Hospital and Research Centers. Dr. Pareek will be talking about the hospital sector as well. And we have Dr. Pankaj Gupta, Head and Access Health Digital. He is very renowned. He comes with diverse expertise. Welcome, Dr. Pankaj, to the panel. And we have Mr. Angshuman Sarkar, Principal Consultant ThoughtWorks India, who's also going to give us a lot of knowledge from the industry perspective, and he's also closely working with the NDHM. So we are having a very good panel, and over to you, Dr. Biren, for an interactive session. Looking on to it. Thank you.
Thank you, Pratibha. First of all, we would like to appreciate the efforts of Elets and eHealth for pulling out all the diverse background people on the common platform and deliberate on the NDHM. So I welcome all of my co-panelists, and without wasting much of the time, what we will do is that we will run through this set of the questions, and I would request all my distinguished panelists to reflect on it for 2 to 3 minutes based on their own experience and own perspective. And once everyone finishes that particular deliberation, we will move to the next question, and towards the end we will have a Q&A session where the audience can just raise the questions or the queries that they have. So what we would like to start with is that at this juncture of the Indian healthcare scenario, how do the panelists see the National Digital Health Mission at present, and what will be the future of Indian healthcare scenario with NDHM objectives being realized? So one by one, can anybody start? Dr. Ravi, we can start with you. Dr. Ravi, can you unmute yourself?
Good afternoon, everybody. And this is welcome to the Elets Health event, which is, probably one of the most innovative, informative event they have. And they have diversity in their discussions and topic covering the vast aspects of Indian healthcare. Coming straight to the NDHM, this is it's been meant to transform the fundamental blocks of healthcare. That's exactly what we are. At this juncture, the question you asked is Indian healthcare scenario. Let me just say what is, I think, just in brief, what is NDHM is aiming for. They're aiming for basically 5 different things. That's something called as creating a unique health ID. That means every individual, every Indian, the citizen gets a unique health ID, and you can carry the ID wherever you are. Number 2, DigiDoctor. That means the repository of the healthcare facilities. All the facilities are probably listed there. Wherever you go, wherever you are, probably sometime we travel from one place to another place. Suddenly we land up in some remote area. We don't know what to do. Some people fall ill. Probably that will help out the facilities which is available and applicable as per your condition and for your facilities nearest location. Then the health facility register, that is something like the all medical facilities. In fact, DigiDoctor is basically all doctors, and the health facilities, health facility register, the hospitals and diagnostics or whatever the other facilities are. Holistic probably not today because we're talking about holistic medicine. Then the personalized health record. The very important factor is the personalized health record, which is controlled by the individual. It is a little different from the electronic health record, the medical record, because this is where you can control your health record, to whom you can share, whom you don't want to share. That's another component of it. And this is, I think, one of the most important component. And based on the understanding of this, probably the success will be there. Then lastly, the electronic medical health record and electronic medical record, which is definitely exist in many of the private sector and private hospitals. And especially I come from Onquest and oncology background, where an oncology hospital, they already have a well standard, treatment protocols. They have history, everything electronic medical record. It's majority of the private hospitals now it's available, and the government hospitals all also have there because with the Ayushman Bharat coming in. Now, these is, I think, the five interesting components of digital healthcare. And along with that, anybody can enroll. Anybody who is like a healthcare provider or a hospitals or the diagnostic center and the software vendors who can create. Yesterday, we were discussing the major kind of whether digitalization occurs is there in India or not. To our surprise, there are about there was the data which came out with the 2,500 the lab management or the HIS providers already exist in our country. So it's not an easy job. There's so many, these are all like listed out there. Probably there are many, many more are customized. So I think this is what the Indian healthcare scenario and digitalization space is. But to bring them together, bringing it at the one platform, it is going to be a very, very mammoth task and a difficult task. And but it's very important to have the NDHM or National Health Policy Vision, which was document released in 2017, which said that health and well-being for at all people at all ages and continuum of care. These are two important fundamentals which probably NDHM this will transform the healthcare space. And basically, it's little different. It's creating an environment. It's an ecosystem. It is not just one system. Creating an environment around it, involving everybody, whether the private sector, the public sector, maybe the diagnostic devices, whether it's research or the software guys, healthcare digitalization happening along space. So I probably feel it's a very, very, and we are at a very, very important stage, and the change which is happening, and the COVID pandemic of late, which is already must have seen, whatever we were thinking in the space of telemedicine, teleconsultation, digitalization, I think we thought probably come in 5 to 10 years from now. Today, that has already come. So we are already ahead of that now. And so it's a time to think big and start this small and scale fast. I think this is where the NDHM, this digitalization can really help. And this is where we stand today. Over to you.
Right. So, Major Dr. Pareek, what are your views in terms of how the future can, completely transform with NDHM goals being realized?
Thank you, Dr. Biren. I'm after retirement. I'm the executive director of a cancer hospital. So, like Dr. Ravi is in Onquest, I also deal with the cancer patients, and our hospital is a standalone cancer hospital, and we have the cancer registries. So, how to value data are very well known to us because these have a long-term effect. Now, coming to the subject of the digital health mission, National Digital Health Mission, at present, I mean, the issue was that at present where we are, that Dr. Ravi has already deliberated. But suppose another part of the question is where we will be, what will be the effect once it is established, like phase 3 is established. So, it's a very good scheme. Since individual will have his DigiCard and there will be DigiDoctor and then the health records. So every individual will be able to see his records anytime. So that is one biggest advantage the scheme with the mission will have. The another will be that, it will definitely reduce the cost. By what I mean to say by reducing the cost is, suppose an investigation has been already done. And when there are the manual investigations, when the patient visits another doctor, that too personally, then he also advises a battery of investigations. But when everything is telemedicine is there and when all the records are based on the data, then the repeat of investigation will not be there. So virtually this digital health mission will lead to efficiency, efficacy and transparency. The data were available. The hospitals will also have the record. And the best part will be at the national level, our leaders will be able to form policies related to the healthcare very clearly, because they will have the exact data. The other issue which we'll have is that billing, clearance of billing. Like today, when there is a manual record, the TPA and the MPanel organization bill has to be loaded into their site, and then see when everything is visible to everybody based on certain requirements, certain guidelines. Then I think it will be open to everybody, and fast the speed will be there into the clearance of bills, so that will further lead to the efficiency. The individual can go to any place and take their treatment because his record is available, and the doctor will be also sometimes when you ask the questions you may miss something which is very relevant in particularly in non-communicable disease, that some aspect has been left. But if the record is there, then everything is on. So I find that the mission, when it is completed, will have a lot of utilities for patient, for the hospital, for the government, and there will be public and private partnership at very large. All the private hospitals will take happily take part into this. So this is what I would like to say at present. Thank you, Dr. Biren.
Right. So now I will turn back to Dr. Mishra, who is representing the government setup. So, Dr. Mishra, since we have perspective from the diagnostics as well as the healthcare provider from the private or the public sector, what are your takes and what are your learnings from the running the TB program at a state level? What will be the future with NDHM goals being realized to address the public health challenges of this country? Can you unmute yourself, sir?
Now, am I audible?
Yes, sir.
Yeah, thank you very much. This is a nice forum. I will be learning better, I think. But coming to exactly the NDHM. So today, if I talk my points based on the tuberculosis, so there are two things that more or less more than 50% of the TB patients are taking treatment because of from the private providers, and less than 50% from the government health section. So whatever the money is invested directly, so whether not only the money, I will say all the resources. So through the National Health Mission and other sources. So most of the time we are occupied with the government perspective, and to the patients being treated through in the government health facilities. At the national level and the state level, it was realized that this is not going to move us at the pace required for the national TB elimination by 2025. So now the more or more patient
I think Dr. Mishra. Okay. So I think he will take. Yeah.
So, no. So
Correct.
is it now?
Yes,
So yes, sorry for this poor network. So now we have realized that today we are talking about the evidence-based knowledge and evidence-based standard practices. And since 2006, the International Standard of TB Care, first edition, second edition, third edition was drafted. Then in India, standards of TB care in India it came into force. TB notification has been become the mandatory across the country since 2012. Now, anti-TB drugs have already been included in the Schedule H1, but all these efforts, I have realized that people, how much we are supporting towards the clinical decision making and the prescription behavior. So we are segregated in the private sector and public sector. So the earlier panelists were speaking, both of them is happening to be the oncologist or the cancer hospital. But then comes how much money out of pocket is spent from the people, how much government is providing. So all these things, so we have now the very necessary to expedite this NDHM concept, so that not only the accessibility and equity, but the lessons are learned from the COVID-19 perspective, that only the ventilator and increasing the beds are not going to strengthen and making us prepared for the next epidemic. So these are my saying, that we have to work together how to expedite the clinical decision support system, so that the prescription can be audited and the doctors can be helped to make appropriate decisions. So this is my that much, and we will take further questions.
Dr. Gupta, so since you represent the digital side and being a doctor, you might be well versed with the challenges that the healthcare workers at the front line faces, right? So where do you see how the future will shape up with reference to India?
Sure. So we have to understand three different keywords in this context. One is NDHB, National Digital Health Blueprint. Now, this is the reference architecture and the related digital health standards that were published by Government of India as a compendium. It is a book that was published called the National Digital Health Blueprint. So there was a mandate given that the further deliberations on digital health will be done based on this blueprint. The blueprint also said that there has to be a National Digital Health Mission, which is a government body that will have to be created to implement the National Digital Health Blueprint. And that is what has happened now. On 15th of August, our Honorable Prime Minister announced the National Digital Health Mission. The third keyword that we have to understand is National Digital Health Ecosystem. Now, National Digital Health Ecosystem is the objective of having a National Digital Health Blueprint, making the National Digital Health Mission, and bringing all the different components of the ecosystem together so that the National Digital Health Ecosystem can be created. There are three different levers for change. One is the health insurance lever or the financial lever. Now, what is happening is that because of Ayushman Bharat and the universal health coverage which is coming into place, the entire health insurance ecosystem is shifting from a pay out of pocket model to a payer-based model, a health insurance-based model. Now, look at some numbers. Now, before the health insurance, Ayushman Bharat came in, on the private health insurance, India had only 3% of India's population covered by private health insurance. If you add another 10%, which is the government health insurance programs like CGHS, ESI, and so many others, that's about 10%. So it's about 13% of India's population covered by health insurance. Now, with Ayushman Bharat coming in, it adds another 40%. So we've already crossed the 50% mark. So we've reached 53%. In addition to that, there is consolidation of all the health insurance schemes that is being done. The government health insurance schemes are now coming onto the PMJ platform. The states, out of 36 odd states we have about, and union territories, we have 33 that have already signed up, and they're joining the same platform. So there's a consolidation of all the health insurance that is happening. Obviously, the number of claims are going to go up by 10 to 20 times. Now, that cannot be handled manually. So the days of doing manual health insurance are all gone. You will have to make it digital. Now, if you have to make it digital, then where is the model for making it digital? That is the reason National Digital Health Blueprint was conceived, that we will have to make the health insurance claims completely digital. We as an NGO have been working closely with the government and other agencies to create something called e-claim standard. Now, this is a e-claim standard that will come into being as we proceed. It will start asking the entire ecosystem to start giving the claim in a standard format, so that the turnaround time can be very fast, just like you swiping a credit card, or the way you make payment through a fintech. So it is going to become that simple. So that is one lever of change. The second lever of change is epidemiology lever. About a year back, when we were hit by the pandemic, all of us were caught completely off guard. Now, this is something that was envisaged by the National Digital Health Blueprint. It very clearly envisaged and sort of anticipated that the entire healthcare ecosystem is broken. The pandemic did not break the system; it only exposed the broken system. It was already a broken system. So, what it showed was that, there are pieces of the health delivery system that don't talk to each other at all. Now, if you have to bring the data together for epidemiology analysis, it's not possible. And that is exactly what we saw when the pandemic hit us. We didn't know what is hitting us. We didn't know what is the scale of it. We didn't know, anything about the epidemiology of the disease. And it took us a while before we could get our act together. Now, this pandemic is not gone yet, and this is not going to be the last one. So, obviously, we have to get our act together so that a national digital health ecosystem comes up. And once that comes up, that is going to support us to do all the epidemiology analysis, not only for the pandemic, but for the epidemics and for the various disease programs that exist. We have 39 plus vertical programs, which are disease-based programs, exist in this country. And the epidemiology analysis doesn't happen to the level that we really want. So, that is where the national digital health ecosystem has to play a role. To make that happen, the National Digital Health Mission has to bring all the different pieces together based on the reference architecture that was published in National Digital Health Blueprint. The third lever of change is e-governance. Now, e-governance basically means is one India, one healthcare. So you should be having portability of your healthcare. If you go from one state to the other, one part of India to the other, you should be able to get all your health services, and you can layer the health services on top of it. The first health service that is being layered on top of it is basically the vaccination program which is going on. Now, that is using a digital backbone to roll out the vaccination program. So every person who gets vaccinated is authenticated via a national health ID, and that national health ID is connected to a government ID, preferably Aadhaar, but it could be any other government ID. And then the record is sent to a DigiLocker, a safe place, because the second dose also has to be given. That so and so person has been vaccinated, so obviously the second dose will have to be given, so you need to store the data. That's just one example. I am just taking a vaccination example because that is current in nature. However, there are multiple services that can be rolled out, and that is where e-governance comes in. And Modi ji's vision is to have one nation, one health, just like one nation, one ration card, and one nation, one vote. So that is the kind of an agenda that we are sort of following, and that is a vision. And that was the reason why all the effort was done over the last couple of years to create a reference architecture called National Digital Health Blueprint. NDHM is just the government vehicle. It is a government body that is implementing what was written in the blueprint. I will rest my case. Thank you.
Right. So before I turn to Mr. Sarkar, who represents the consulting domain. So Mr. Sarkar, you are well aware with the the limitation and the strength of the public healthcare sector versus the private healthcare sector or the diagnostic sector. What are the skewed demographics or the population outcomes or the health indicators in different states, right? If we compare Gujarat versus Kerala, or let's say the UP versus the other state of Tamil Nadu. So with this diversity, with this unevenness, with this local flair, how do you see that government coming out with a good policy vehicle in terms of the NDHM? How it is going to transform the Indian healthcare scenario going forward? What are your takes on that?
Hi. First of all, I'd like to thank Elets and HLF and to you, doctor, for having me here. I'm probably the only non-practitioner over here, so go easy on me. I think, let's understand. I think, Dr. Pankaj already explained very nicely. But let's just think about digital health. What does the digital health mean? Now, and that probably sets up the context to answering your question. Now, it's not about point system. It's not about digitization. It's not just about going paperless, digital literacy, on adapting EMR. It's about a holistic and a strategic technology intervention in, say, services and application, infrastructure, standards and interoperability, supported by workflows, legislation, policy, compliance, strategy, investment, right? And providing continuous, almost near real-time basis to leadership and governance, towards decision making. Now, you are right, and in terms of how fragmented our healthcare deliveries are, and how each layers cannot leverage the information from the other layers. And if you look at right at the bottom, we have the PHCs, and you would think about, hey, this is probably the layer where you would want to get population level data, right, for information that is foundational for surveillance, monitoring health, for purpose of planning, implementing, evaluating health interventions. And if you think about the second level, which is the, say, our subdivisional hospitals, or say our district hospitals, and you would expect clinical reporting to be done over there. And but none of these layers, for example, talk to each other. So problem is, across all states, this multi-tiered, disconnected and fragmented structure, and also usage of the technology is non-existent, right? Which makes any sort of an assimilation and analysis of the patient information a Herculean task. Now, some states, for example, are obviously, you can say Kerala or southern states, they are probably much better in terms of their preparedness, in terms of adoption of technology. And compared to say other states, or in the Northeast. But at the same time, I think we are in an advantageous position. Why? To me, it's like a green field, right? When you are starting from a green field, you have some inherent advantages that you are not bogged down by legacy systems. I mean, if you think about making even a change in the advanced countries, like say United States, that's the cost of change is going to push down any sort of a progressive or affirmative action. Now, in our case, we are not bogged down by legacy. So we can start from ground zero as a green field, and with the NDHP as our guiding enterprise architecture to take it forward. Now, that would be my case, that I know we are in a fragmented in a world. The state or standardization of healthcare across states are probably varies widely, but we can't just be bogged down. We just need to move ahead, and NDHB, NDHM provides us this means to go ahead.
Right. So now, since India is a technological backend or the powerhouse for the global countries, or the the like the Western worlds and all, right? So we provide the technological support to them. So we have a fantastic industries, IT industry, which is leading across the world. Now, with this context, as a healthcare leader, what are the challenges that you see? Because what I personally feel is that if NDHM goals are realized after 20 years or down the line after 2 decades, it will not going to serve the purpose, right? So if we have to fast pace this particular adoption of the digital health or the e-governance module in the healthcare system, what are your thoughts that what we can learn from the other global countries or from the other industries? So one by one, I think Dr. Ravi, you can start and then others can follow.
Well, I think I was hearing nicely and good thoughts of diverse thoughts about NDHM and the blueprint. I think blueprint is definitely a wonderful document. It is a lot of effort has gone into it. But I think, and there are definitely, I am very, very optimistic that this is a very NDHM digitalization is very positive and the trend or positive step which has been taken by our honorable Prime Minister. But I have, because I am from diagnostic and we work on the on ground actually, where we see the say from diagnostic, there are about 1 lakh plus labs. Only about 20%, 25% are governed by the structure segment. There are only about 2,000 labs, which are accredited labs. There is no really quality protocols. Whether there is similarly for the hospital, we don't have much of accreditation, NABH hospitals, and there's no standardization of protocols and treatment. So I think I'll come back to that with this background. Like, okay, to me, it's too early to comment on the mechanism and how much more benefit. But yes, definitely, if you look on the face, it is a need, and this will help us to work out, if handled well, it can be a good database for diseases and healthcare monitoring. It will definitely revolutionize the provision and public health research in India, the budget planning, the geographic planning, prediction of epidemic, endemic, control management, pandemic. I think that is definitely because we can define hotspots, which area, which diseases just picked up, the dengue is happening in this area. So can we rush our medical facilities there and control and contain the endemic or epidemic is happening out there? It can understand the treatment history, how the various ethnic, various regional people would, respond to the treatment, and mapping of the facilities, mapping of the patients, behavior. But then there are, I think, strong the as of now, if you look at the healthcare structure, there are many challenges and negatives. And one of this is like there is the myth, or probably there is I'll the kind of the information which the various hospitals and diagnostics and various providers will not like to share with each other. Will they like to share with each other what I am a doctor, I'm prescribing this medicine, and after some time, some other doctor, what treatment is given, this might open to a door of litigation. Who knows? I think this is one of the apprehension in the doctor's mind. Then there will be, issues of what will happen to my data, privacy, the various stigmas, ethical issues. What is going to happen to that code? What will be the security issues? Now, biggest hurdle I think is the meager. I think I'll probably say our health budget, and I'm sure that it will provide how much will be the healthcare for all budget will be given. And today, if you look at the expenditure, the total health expenditure with the public and the private in India is about just 3.6%, while public spending is health is about one little above 1% of the GDP, which is too low as compared to the countries which has adopted the best digital health systems, which are like US, UK, Canada, and South Korea. Probably they're the good thing. I think we need to learn a lot from there. Can we, public health support system, can this kind of a funding, we will be able to, unless it is supported by funds, I think this is going to be a mammoth task. Now, another area which is probably, if you see, have the burden on doctors. Will our doctors, what they feel, what is their benefit? They feel going to be extra burden on them, extra cost on them. And one data probably I pulled out somewhere. This is like from US, the example, they said, in Pennsylvania, Safety Authority found that between 2016 and 17, the EHR led to about some 700 problems during the lab testing. And this is because there's some kind of a 54% because of the human computer issues, and remaining were by the computers alone. Now, this is something, if the report goes gone and after 5 years, I have to, some other doctor gets my report, like I had probably high sugar level in 5 years back, now I'm not there. Will my treatment be affected by that? I don't know. I think that's another area. Similarly, the doctors who are working hard, somewhere I think Another data says that doctors work for about 12 hours, 11 and a half hours on average, out of which about 6 hours are spent on electronic health record maintenance. And remain out of that, even 6 hours, 50% time was on a clerical documenting it kind of a thing, and remaining was some kind of a mail and responses. So will the Indian healthcare space, Indian healthcare providers, are we ready for that? That's another challenging area. Then there are many other undiagnosed diseases, which is like the how to bring like self-treated morbidities. We have a lot of holistic approach. Probably a lot of the people have been treated beyond the mainstream line. Like holistic, we have allopathic, we have Ayurvedic, we have Unani, we have Ayush contact system, and a lot of population, and they're doing good work. How will they integrate that? How will it help? Kind of a thing. So, these are, I think, many of these such challenges, which is we're going to face. But without saying that, I think it is very important for us, unless we have like Ayushman Bharat or whatever we have, NDHM, Unique Health ID, unless we have this, we are not going to progress. We will not, because we definitely require this, for a short-term gain, probably I'll say, the repository of facilities, and developing first and foremost will be to have the acceptability and the consensus, because you see on the other end we have Clinical Establishment Act. A lot of states in the center, a lot of states and a lot of medical bodies are still not adopting it. They're not willing to have a transparent pricing. So these are, I think, the challenges. But then advantage is definitely there for as we grow, probably we can create more uniform awareness program, education program, trends kind of a thing. Alerts can be given, but again the data, whatever the messages, because if you say the internet today, if you go to the education plans and awareness plan, unless you have a very well validated, very well accredited, very well quality conscious and healthcare system, probably putting across the entire data into one platform and making this a base of our health trends may not work out, which it appears to be. So it's not only the creating a system, probably what I mentioned to it is creating an entire ecosystem, quality, regulation, practices, protocols, standardization, making sure the right data goes into the system. And then, of course, they have a personal PHR is definitely a part of it, so that individual is very free to pass on data to whomsoever they want at their own consent. That will at least some apprehensions will go. But in the long term, is definitely a need, and that will be a be good platform to create research, analytic application, advanced planning, awareness, and lastly, I think we will be able to say probably today we think about our healthcare as a spend. I think it will should not be taken as a spend. It's basically earning. If you can see probably the impact of this early diagnosis or a trend or healthcare management because of the entire document which is available to you, you probably hospitalization might reduce, emergency care may reduce, or health expense might reduce, and probably the man-hour loss might also be reduced. So probably it will be investment into this will be more of a you can say a productivity and more benefit probably, and will get more benefit to this. Right. So not affected by the challenges. Challenges are there, big challenges, but there is a need. But we need to address all the challenges and apprehension to make it a full success.
Wonderful thoughts. Major Dr. Pareek, with your background in armed medical corps for so many decades, let's say if healthcare sector we want to adopt NDHM very quickly, let's say down the line next 3 to 5 years of time space, what are your learnings from the medical corps that may be beneficial and helpful to the entire country? You may unmute yourself.
Thank you, Dr. Biren. Little correction. I am Major General. Major I was 40 years back. Kindly keep it in mind. Anyway, coming to your direct question of armed forces. Let me tell you, how the armed forces system works. We have, like you all must have heard about Army Hospital Research and Referral, which is located in Delhi. But we have hospital in Kargil, we have hospital in Doda, we have hospital down south in Audi, we have hospital in Badmer, all these hospitals. So way back in 2000 itself, this concept of telemedicine was introduced, and people sitting at these peripheral hospitals. We have a concept of peripheral, mid-zonal, zonal, and the command hospitals. So all commands and the army hospitals and referral, the other peripheral hospitals are well connected, and that is why there is a speed of care. Like I will share with you some example during even the Kargil operations, that a CT scan report can be confirmed by the Army Hospital Research and Referral Center within some minutes. Today, I'll give you the example of this hospital. Today in the morning, a friend of mine rang me up from some other town about whether iodine therapy can be given to one of his patients, and he sent me the WhatsApp me the documents, which I sent it to the nuclear medicine specialist, and I think within 20 minutes time it was conveyed to him back that yes, you bring the patient and it will be done. So speed is there definitely with the digital health, with the digital data processing, with the digitalization. There is a speed in treatment, there is a speed in diagnosis, and the cost has cut it. In enough, Dr. Ravi has deliberated on the challenges, and the one of the challenge, yes, remains is the budget, because in the rudimentary form, in the different form, in various hospitals, as per their requirements, there is some kind of digitalization, but we still don't have that card, the unique ID, which is available to the person. So if that card is made, for which you require budget, I think the Dr. Mishra will confirm that around 140 crore budget has been planned for this mission. So when it comes and this ID is prepared, then yes, and one challenge, another challenge which is taken care is cyber security. Then after that, there will be a speed, there will be a transparency, there will be efficiency, there will be efficacy, and patient can go anywhere, take treatment, cost will reduce, claims will be cleared very faster. So because the situation, the problem which we have is, I think about a lakh plus unique ID has been prepared till now, and about 400, 500 DigiDoctors registration has been done, and very few hospitals have been registered. So this has to be fastened, and I'm 100% sure that when the digitalization takes place, then the national health will accelerate, and you will be able to pick up. The most important is you will be able to pick up the preventive disease. You will be able to make awareness about the preventive aspects. Like say for example in the cancer also, if you can diagnose early and at the first stage and treat the patient, then you give him the longevity and quality both through the life. So the digitalization will be definitely useful, and as question asked to me for armed forces are very well using it for our peripheral hospitals and during the operations. Let me also share with you that even in Sri Lanka, when the Indian Army has gone and the doctors were operating there, and some kind of a consultation from the tertiary care hospitals were taken and it was provided to them. So there is no, I'm in denial about it. Only thing, it has to be accelerated. It has to be done in timeline, like the government has given 3 phases: phase 1, phase 2, and phase 3. Phase 1 is for union territories. I'm really not very sure whether that phase 1 work has been done or not. So because unless we do it for everybody, even if we leave 1 or 2 people, then yes, there is not a success. So if we really want that the NDHM should accelerate the healthcare facilities, then it has to be done expeditiously for everybody. Thank you so much, Biren.
Right. Wonderful thoughts. Now coming back to Dr. Mishra, uh, like from your example from the state of Bihar, which has transformed significantly towards upward side in the healthcare outcomes of Bihar has improved significantly. There may be like reasons like the political stability, the team and the various, the international and the national NGOs coming into the picture and trying to work for Bihar, especially during the early 90s and the 2000s. What is your experience that how the other states, and for that matter all the states of country, can jump in and support this NDHM mission to being realized, because we have seen that in Ayushman, few of the states even today are not using the full potential of the Ayushman scheme. So with reference to NDHM, what are your experiences and what are your comments and suggestions for the states to follow?
One thing, I will give you two examples. Two examples. One example is that there is a pharmacovigilance program of India, PVPI, and when bedaquiline and delaminid and these other newer drugs were introduced for the treatment of drug-resistant forms of tuberculosis, it was one of the mandatory for us that we have to record and report each adverse effect digitally, so that this could be, we can see how much these drugs are safe. So the digitalization is really required. And but another example is that I'm also state program officer of the Anemia Mukt Bharat program. So even the Anemia Mukt Bharat program, it records and reports in the HMIS, and then all of a sudden these things are good that we have covered, so say more than 80% of the pregnant woman under the for this early registration, and then iron folic acid tablets are given. But when the National Family Health Survey report comes, that these coverage are very less, and rather the nutrition level has deteriorated further. That is another concern. At the same time, when we have evolved to get e-Aushadhi, and there are many platforms for the digital recording and reporting, but then when for almost 10 months altogether the schools were closed, so no even the primary schools and the secondary schools, the children were not coming to there. So what happened to the weekly supplementation of the iron folic acid? So as a government officer, from the policy level, we issued the letters to all the education officials, and that during the lockdown, they can take the medicines from the Anganwadi. Oh my God. The Anganwadi centers or the Asha. But then how it will be reported, how it will be recorded. So my request, humble request, is one thing, that we have to be very much faster, what Major General just emphasized in his better words. So there is a cost of the change which is required, but we need to invest it. And there is a cost of also not changing not changing at a pace it is required for the implementation of the NDHM. For all these things to happen, what is this platform, I want to request to all the participants and those people who are hearing, that whenever we talk about the partnership means we are outsourcing something to get it done through other people. No, the partnership between the policymakers, between the program managers, ordinary person like me, and also the community representatives. So just before joining this forum, I was talking to Dr. Smriti of TB Reach. So we are working in the 14 districts. We have trained almost about 350 TB patients, and they are now TB survivor to TB champion. And we are assigning them not the role of only the counselors, rather we will be getting our data that how much stigma the TB patients are facing. So stigma assessment will be done by the TB patients, because they have undergone these kind of pain and agony and this affliction is caused by the Mycobacterium tuberculosis. So
Okay.
basic things have to be corrected, and we have to engage. There are too many young people who are working for the call centers. Why the government is not hiring for them? Even the entire, I was a state nodal officer for the COVID-19 trainings. Very bad experience I have, that all my TB workers were doing for the last say 9 to 11 months, only they entering the data on the COVID portal, and still that COVID data, the information is not dependable. What my other panelists said, that this data is not dependable. So how much we know epidemic? So this much I want to tell you. Thank you very
Thank
much.
you. Thank you, Dr. Mishra. So now we have around 10 to 12 minutes left. So before we jump to the audience Q&A, the last comment that I want from every panelist. Now, NDA at National Digital Health Mission is a good document. If the objectives are realized, it is going to completely transform along with the Ayushman Bharat, the health care scenario of our country, and which can be the example of the other developing countries as well. Right. We also know that at the other extreme, we have the limitations, we have the skewedness, we have the the local fare. It is very difficult for one common objective or policy to be simultaneously executed across the country with so much diversity in place. Right. But at the same time, during the COVID-19 pandemic, at one extreme, the broken system has been exposed. At the other extreme, we are the first country who vaccinated around 2 million population in no time. Right. Our outcome data, our the way our frontliner doctors and the paramedics have dealt with the COVID is really an example for the country. Even the WHO and the UN chief are acknowledging. So, what is that X factor that we as an Indian or we as an Indian healthcare scenario has, which will enable this NDHM mission to be realized? And please be specific for less than 1 minute. So before we turn up to the Q&A, that X factor that we have.
I think the X factor definitely is the desire at the top level. The top leadership has a very long desire of implementation, and that is why they have created certain groups and committees to do it. The another thing is there is a participation of the private hospitals with the government hospitals, and that is the second point which will bring out the success into this digital health mission. And third is the individuals, in the urban area, those who are educated are for it. In the rural areas, also they understand, because when they have made Aadhaar card, you have to just explain them. So to my mind, yes, the X factor is governments will, the individuals' participation and public-private partnership is coming into a big way for the success of this mission.
Mr. Sarkar, what is the X factor?
So, if I may go next on the X factor, in my opinion, X factor is the Jugaad technology that we have. And I really mean it, because when India is so diverse and unique. When the telecom revolution happened in India, we found very unique ways of implementing the telecom in India, which the world had never thought about. And that is why we leapfrogged many generations of telecom and went straight to the mobile. Similarly, the fintech, the way we designed the fintech, and it has become a revolution. And it's shown the world that, we can transform the world in a completely different way. So a completely new model of digital health will emerge from India. As a country, we need not copy the West. If we go and copy the US has failed on digital health multiple times. If at all we have to learn from US, you have to learn what not to do. I have worked extensively in US and Canada. I worked in the Canada Health Infoway also. Now, that's a very structured model. You cannot copy it and bring it to India. If you were to go to an Estonia is 1/10 of Delhi. You can't copy it and bring it to India. So, a completely Jugaad-based Indian model has to emerge, which is not going to bring standards from outside. It will have to be standards that will be de novo, created in India, and only then it will be a success. If you bring something from outside and superimpose it on India, it's going to fail.
Right.
I think
Mr.
very
Sarkar, if you can.
rightly said. I'll I think add on next to it. I think one
Right.
of the very most important part is we have the probably best skilled resource for it and hunger for a disruptive innovation, and that is where and the second part is the flexibility and adaptation. I think Indians have this kind of a thing. We are ready to adapt to the situation very fast, customize it to the deliver, and it's outcome based. The hunger is to deliver the like as best as possible. And on the top, if we have a political desire, we have a policy regulators. Now they have also understood this. So I think the combined strength together. That's what on the one side we have a population who's their list of disruptive innovators. You give a task to somebody, 2 days he'll produce something nice and different, which can help and which can be a local, Nirbar kind of a thing. It can be done more of a ecosystem which can be hyper local kind of a thing can be easily created now. People are willing to accept it. It's a fairly good quality and it's sorting out the issue. But I think the integration together, the political will, regulators, private sector, the government sector, and of course the new generation, which is now they're globally connected. So I think it's very important to have, because first and foremost in healthcare, let us connect internally first, and once you're connected internally, you can connect externally and globally, and that's what the hunger is there today to add the one platform. And probably this is what going to be the next change, which is the wave of the future. This is an answer to improving the patient healthcare and important to improve the health of Indian healthcare. That's probably a must, and that's the advantage we have today.
Right. Mr. Sarkar.
Yeah, so I will say a couple of things. One is, I think, leadership, what others have already said. But I think in this leadership, there is a significant change. We are looking at emergence of something that's been called as government 2.0 or government as a platform. You have seen this example, like say in UPI, right? Like in a UPI, NPCI, what it's doing is just the horizontal backbone, and top of it, you see PhonePe didn't exist. One of the largest companies, today, right now. You see Google, Pay, and you may not know, but all of them actually use UPI. So similarly, I think that NDHM is trying to create this horizontal backbone as a platform, right? And it is like this, right? Think about GPS, which is a national level, resource. And on top of it, you say, okay, Google provides location services. On provide, Uber or others provide transportation services. So this sort of a layered, innovations, and at this, government working at the core is going to be one differentiating. And I think this is going to be the breaking point. The other part is the talent pool. I mean, we have 15 lakh, engineers, out of that 2 lakh, computer science graduates coming out, this is what I call as a do-it-yourself generation. But think about it, the healthathon that was, organized by NDHM, a team, and I know this personally because I know the team, totally in non-health, domain, worked for a month and created an AI-based, claims processing engine in 1 month. And while they were doing their, daytime jobs with their things. I mean, if this is not, so I think that government is providing this collaborative platform, and we are going to see this explosion of this innovation and idea, and which is need not be done by big companies, at all. It is just coming from, because people feel I need to do something, there is a lack of it, and I'm going to do that. And there is an ecosystem for it.
Correct. Dr. Mishra, what will be the X factor?
For me, what I have learned from Niche, our portal, for the recording and reporting of the TB patients, and also the Niche Poshan Yojana and DVT, the linkage, it could never have been possible to pay rupees 500 on at the rate monthly basis or the 2 monthly basis to such a huge number of patients if we have not adopted it and convinced our entire team for this digitalization process. Time, what my colleagues and the panelists said, the decision or the ownership at the leadership at the top level, I would request that the middle level and the lower level even in the government system and in the private sector also. So if the IMA local branch president and secretary or the collector owns the data, or even at the block level, if say Panchayat Pramukh and BDOs and the other NGOs who are working, we should own the data. We should be very much serious about the owning and using the data. The day we start using our own information, which is coming through the digitalization, then of course this is the era of artificial intelligence, what sir was telling about the patient call and all these things. So I'm looking positively towards this, but we have to own it at the lower level also and make it acceptable more. It should not be imposed from the outside. The thirst, what he said, that the thirst and the hunger should be at the each level, not at the top level only.
I think the world is realizing what is the X factor for India. Recently, the Bill Gates openly accepted that the humility of the Indians, if that potential is unlocked, then there is no going back for a country like India. And I also believe that truth alone triumphs, like Satyameva Jayate. If we remain true to our commitment towards the NDHM objectives and goals, and as Dr. Mishra has said, that not only from the top leadership but from the mid levels and the grassroots levels, if the people's participation is there, empowering the population is there, I think there is no no stopping from us realizing the NDHM goals. So it is very elaborative, very the holistic discussion we all had on this particular topic, which is going to be the futuristic in nature. So before we close, we can take the question like how will NDHM accelerate the country's progress towards universal health coverage? So Dr. Mishra, you are the right person to answer. How it will achieve the universal health coverage.
uh, Frankly speaking, I don't know, because I'm right now very much occupied with the basics, correcting the basics first. But of course, my leadership at the top level, Principal Secretary Sri Pratyay Amrit and my ED, Sri Manoj Kumar, they are now very much digital savvy, and even the Sri Lokesh Kumar Singh, who has been heading the Ayushman Bharat. So they have wonderful experience with the digitalization and they have tested it. So I am looking forward that similarly, once the people will start using the data, whatever is coming for the whether it is the insurance or to provide additional support in forms of rehabilitation or the financial assistance, then it will be a major breakthrough. But let us use the data available and have develop a thirst that it is required and at the faster pace. This is.
Dr.
I
Ravi,
want one point for a 2 seconds. One of the important thing it will help is the kind of, if you have a universal ID and the whole EMR or public health record in one place, the data which will come out of it, probably that will help us out to understand the gravity and the requirement of the new people. And that will help to redesign, redefine and how to place our resources and work on it. And that will be a big step for the universal health coverage.
Correct. Right. So this is the question, that national health ID will be for the only those who are hospitalized or suffering from ailment, or for all the citizens of India. Dr. Ravi, I think you have a vast experience of health IDs. So it will be for everyone or only for the hospitalized people?
No, it is going to be for everybody, because anybody, whether it's a hospitalized and OPD or you're a routine patient or even a preventive health check, whenever you go, it will be across one ID, and which is interoperable, transferable to everybody. Only thing is, advantage here it is, it's in your hand. You have to give the consent so that the data is passed on to your healthcare provider. And you have free to provide which data and which not data to be provided. This is the one good point, but it's all across any aspect of healthcare for that.
I think those who are already availed the treatment under Ayushman Yojana will automatically get their unique IDs. And right now, the health ID generation facility is available for the union territories of India, and gradually it will be rolled out to the states. Right. And
also, it's in
similarly,
your hand. It's already all you had. Moment you get registered, something which comes to you, will you like to accept it? Once you say, okay, I want to create, then only it comes. It's not like voluntary, like something imposed on you. It is up to your
Correct.
consent is taken.
Right. Right. So we are now towards the end of this presentation and panel discussion. I would like to thank every of my panelists because it is great learning along with the luminaries like you guys. And I think we have done justice to our audience also, right? And thanks to the Elets and the Health platform for collaborating with this wonderful panel. Thank you, everyone. Thank you.
Thank you, Dr. Biren. I would like to say that National Digital Health Mission itself is such a big scheme. We can't constrain our points in 1 hour time. I think the panel has done good justice to that. They have given whatever insights could be given. Thanks a lot for each one of the panelists who had made up their points. So we would like to quickly give the speaker certificates. I would like my team in the back end to please display. Dr. B.K. Mishra, State Program Officer from Government of Bihar. Thanks a lot, Mishra, for your points, sir. Well articulated. Thank you. And Dr. Biren Chauhan, Group COO-Sunshine Global Hospitals. Thanks for the moderation, Dr. Biren. It was very smooth flowing and nice questions. Thank you for that.
Thank you.
Dr. Ravi Gaur, Director and Chair, Medical Advisory Committee, Onequest Laboratories Limited. Dr. Gaur, thanks a lot. You have been always guiding us. Thanks for that, all the guidance. Major General SC Pareek, Executive Director, Bihar Mahavir Cancer Hospital and Research Center. Thanks a lot, Major Pareek, for your, sharing your experiences and thoughts. Thank you. Dr. Pankaj Gupta at Access Health Digital. Dr. Pankaj, thanks a lot for joining in and sharing your thoughts. Thanks a lot, Doctor. And
Thank
Mr.
you.
Angshuman Sarkar, Principal Consultant, ThoughtWorks India. Thanks a lot, Mr. Sarkar, for your points as well. Thank you. We will be approaching you for the next edition as well for such interactive sessions. So thanks a lot again. Thank you.
Thank you.
Thank you, everybody.
Thank you.